All right, everybody, and let me find it here. Scroll up. Welcome to the Mansfield Buzz. We'll be right back with our guest, Crystal Schuder from Schuder Insurance. Jordan's the host with me today, so we'll be right back.
Welcome to Mansfield Buzz, Jordan Hurdy in the mix, spotlighting local stories, every episode's a fix, unearthing unique gems, what makes them shine. Tune in, get ready, we're diving into their grind. With Jordan's questions, we reveal what's at the core. Hurdy's tech wizardry, bringing stories to the fore. Together we create, star showcasing what's unique. Mansfield Buzz, where content creation sleek. Calling all business owners and customers to the scene. Discover authentic gems, find the best you've ever seen. Meet the faces behind each unique space. Trust in their stories, find community in this place.
Okay, everybody, welcome to Mansfield Buzz. It never fails on the dashboard. When I clicked on go live, I didn't realize I'm over here going, where is my music? Where's my music? So I had to add a little bit there. So it's Thursday, it's 2 o'clock, and we are live. And of course, we want to start the show off by making sure we are saying it is September 11th. It is a day in history. It is a day for us to remembrance. We are thinking about the families of the survivors, right? The families, we pray for them. And yeah, it's real emotional to watch that thing from New York City every year. They're ringing the bell and they're naming the names of the people. So keeping that in mind. But with that said, we want to welcome everybody in today to Mansfield Buzz. We're going to be talking insurance with Crystal here in a few moments. Jordan, welcome. Jordan's the other host on the show. And yes, it's spelled Hough, pronounced Huff. Just remember that.
Just like tough.
Yeah, just like tough with an H. Huff. So, anyhow, guys, welcome to the Mansfield Buzz. If you don't mind, let your friends know that we're on right now. You can always go ahead and send them this link right now. If you just go to YouTube and put in at Mansfield TX Buzz and send it to them, it should lock them into the channel. If you would, there's a little thumbs up button right down underneath this video on YouTube. Give it a click, and it helps the algorithm, and it's right down below here. We love that. Also, chatters, as you come in, if you want to ask questions, because this is a big time deal and there's always changes going in 2026, right? So you might have some questions, or you might just have some basic health insurance questions. We want to make sure we address those today. So feel free to chat with us or just say hi. Let us know you're paying attention and you want to say hi. We'll make you famous. I promise. As famous as we can be. And if you want to be on the show, you can always go to Hurdy at hurdyburke.com. There it is. Well, and we just did it. There it is. Jordan, I'm going to let you do it.
I'll drive.
You know what'd be really cool is if once we set this up, they gave permission to one of the people to manage the screens, right? Because Jordan and I can see the same thing, Crystal. So if I click it and he clicks it, then it goes away, comes back, whatever. So it's just part of the studio, which is really cool. So you can email me in the subject line, Hurdy at hurdyburke.com. I will tell you, we are already booked all the way through November. We're now taking the last week of November and the first 2 weeks of December before we take off the last 2 weeks of the year, Jordan. We're going to have 2 weeks off. Actually, 3, because January show start is on the 1st. So we're going to wait and start back on the 8th. So we're actually, Jordan, going to have 3 weeks off. Okay.
That would be the longest break we've ever taken.
Right. But in October, we're going to double up. Because just to let you guys know, I'm going to start putting it out there next week. On Thursday, October 30th, we have our normal show, but we're going to have our Halloween special show. And we're going to let some of our clients come on free, but they have to be in costume. So there'll be 10 of us on this interface right here. And we're going to tell ghoulish stories, and we're going to tell haunted stories, and we're going to play haunted music. So if anybody wants to be a participant in that, I'm going to put that email out next week. So there you go. But everybody, welcome to the Mansfield Buzz. Jordan, I'll let you take over because we have some icebreakers, and you'll notice I put something in the icebreaker for you. But let me go ahead and bring up the icebreaker section, and we'll be right back. All right, Jordan.
All right. Crystal, welcome back to the show.
Thank you. Thanks for having me on. I get to come on once a year.
Yes, I'm excited.
We love
year
it.
has passed, a lot has changed. But in that time, I think you managed to squeeze in a little bit of fun there, huh?
Yes. Yeah. Are you talking about my little trip I'm about to take?
Yeah.
I want to know everything about it.
Gotcha. Actually, we're leaving in about 10 or 11 days. Actually, on the 22nd, my husband and I are going to Rome, and we're doing a Mediterranean cruise as well. So we go to 5 different ports, but we are celebrating our 30th wedding anniversary. So
Wow,
so we're very
congrats.
excited.
I need clap applause. I need to go find some clap applause and add it to our sound effects so we can have
Thank
clapping
you.
on the
Yes,
show. That's
yes.
cool. Awesome.
Yeah,
Congratulations.
we've never been to Europe, so this is our first time. So we're very excited. We're very
Cool.
excited.
That's
Good.
gonna be so
Yay.
much fun.
Yeah, it's gonna be fun.
And a
That's
cruise too. Wow.
Yeah.
Oh yeah, yeah. You're not gonna miss us one bit.
I know. I'm a little nervous because we don't come back till October 7th, but I'm gonna take care of my clients before I leave.
Yeah, good idea. Right.
Yeah.
Because we got that special date time coming up that you're under the gun for. There you go.
Yes.
But she has a daughter that helps her out. She's just not going to say that. Right.
I do. Her name is Harley, so
Yeah.
she works with me. So yes, she does.
That's good.
Next year we'll have to have her on as well. We'll do a double.
Oh yeah, that'd be fun.
Yeah.
It's always cool. And congrats for being a business owner and taking a vacation. It's a rare thing.
Yes, it is. Yes, it is a lot. We still have one child in high school, so my son is helping take care of her while we're gone as well, and his fiance. So we're going to be gone a long time. Never been gone. I've never been gone. Y'all said 3 weeks that y'all are going to have a break. I'll be gone a little over 2 weeks. I've never been gone that long before. So
Yeah. And
yeah.
if
On
you keep
vacation,
up,
that is.
Jordan, if you keep up with Crystal and watch her post, they've been through quite a few things in the last year. They've had graduations. They've had tons of stuff going on within the family, which is really cool. So
Yes, we have. It's been very busy. Very busy.
That's cool. And that's one of those things that I love about small businesses. We're all businesses, but we also know each other, and we can keep up with the little things like that are just great.
Yep.
Yeah. Yes. For sure. Makes it easier to take off. So not all the time, but sometimes.
Yeah, agreed.
Yeah. So anyways, but thank y'all for having me on. I appreciate it.
Hey, we're glad you're here.
Yes. Thank you for coming in before your your trip. Well, you should have done it from Rome and be like, oh, I'm just, in Rome. Whatever.
Yeah.
Yeah, let us tie up an hour of your time from Rome. Sure.
Right.
Yeah.
Like, that's going to happen.
Yeah, I think it's like 7 hours ahead of time or 8 hours ahead of time.
It is. You're about 7. Yeah, that's about right.
Yeah. So but,
let's dive into it. There's lots of things I want to ask you about. And, time-wise, there's Herdy hinted a little bit before, it's something is approaching, which is now the AEP, which is the annual enrollment period, right?
Yes.
Yeah. And it's different, right? Or it's things have changed a little bit compared to last year.
Yes, they have. Actually, the things that have changed, last year was a big change for the prescription drugs. And the prescription drugs, again, are going to have some changes as well. So last year, the max out of pocket was $2,000. And then this year, it is $2,100 out of pocket. So that's the max, which is good. But also it can be kind of bad and just different little things. Like we talked about last year, if they can't afford that, they can get on a payment plan, just different stuff that they can do. And also what came with that is on the Advantage plans, there really weren't drug deductibles. And for 2025, there was drug deductibles, and that evidently is going to continue to be the case from here on out. So the drug deductibles will change as well for 2026. And then also some tier 3 drugs. It depends on the formulary of the carrier that you have. But most of them, if they have a tier 3, 4, or 5 drug, then if it was a tier 3, most of them were like $47 for a copay. And this year it's going to be a percentage. So it's not a set price.
Okay, got it. So what does that mean?
You really need to get with your agent and see what your cost is going to be.
Right.
Especially if you have some pretty big prescriptions to know what you're going to pay. I mean, this last AEP, I actually worked with a client and he had, I think, 15 prescription drugs. And January, his cost was almost $700 just to get his prescriptions for 1 month. So
yeah, that's crazy. And so can you go back and explain when somebody hits $2,100, that's the max.
Yes,
okay.
yes,
What happens when they hit the max?
When they hit the max, then they pay nothing else for the rest of the year. So the client I just told you about, that was like $700 the first month in January. So CMS, they put the regulation, I guess, on all this. So that's Centers for Medicare and Medicaid. That's regulated for the whole United States.
Right.
And they're the ones that come up with all these rules and regulations and everything that we have to abide by, that everyone actually has to abide by and go through. So once you reach that max out of pocket at $2,100, then you pay nothing else for the rest of the year. So with the client I was telling you about, he probably got his max out of pocket probably March or April. And so after that, he paid nothing else for the rest of the year. But guess who does pay that for the rest of the year? The carriers. So that's why you're seeing all these, that's why you're seeing deductibles. That's why you're seeing now a percentage of some formularies for the drugs. So you're going to see that. And it's probably going to take 2 to 3 years for this to all kind of balance out. So just work with someone that is local. It doesn't matter if you live here in Texas or if you live in Houston or if you live in Oklahoma. Work with a local person, not a 1-800 number, because a local person is going to have your back, and they should have your back, I should say. And they'll check and make sure everything that you have and what is best for your needs, for yourself. So, because everyone is different. Everyone's different. So
yeah, and that's really that's very different. You know, when you mentioned the percentage, like some of those medications cost a lot. Like when you get the receipt and it's like, you know, you paid for this much, insurance paid, and then you're like, wait, like some of it is substantial.
Depends on the tier too, right? So there's certain, you know.
You probably pay just a little bit, but for sure. So
the next thing I wanted to ask you on that, I don't mean to interrupt you, Jordan. I just want to make sure we clear this up a little bit. Is that the administration right now says that these drugs that a lot of people are paying a lot of money for here in the U.S. are not almost cost; they're almost negligible cost to the people in foreign countries, and he's trying to get those prices here the same way and not making us the pass-through research. Whatever. So the political side of this is the drug prices are being worked on over time to come back here about the same as they're paid overseas. Crystal, am I somewhat right on that?
I think that is the goal. It hasn't quite happened
yet. No, it hasn't happened yet. But I didn't say it happened yet.
Yeah, I think that is like insulin for starters. When Biden was in administration, they made the insulin $35. So
right
for Medicare people, then you didn't pay more than $35 for insulin.
I think,
So, they have 10 drugs in negotiation for 2026, and these are all very expensive. I'm sure y'all have heard of Jardiance before. It's a diabetic drug. They have Eliquis, which is it's a blood thinner, but it's for heart patients. And some other drugs, I can't pronounce their names, sorry. But there's 10 of these drugs, and you can Google them. So you can Google 2026 Medicare drugs negotiations, and you can pull them all up.
Cool.
So it's not going to show what you're going to pay yet, but it does show that. So you can.
Yeah. Good for people to research it on high medical.
Yeah. And then also, sometimes drugs are not covered by the carrier. They're not covering it. And a lot of people will go to Canada pharmacies and get their drugs as well. So I have a few clients that their drugs aren't covered here. So they went to Canada and got
my point exactly.
Yeah.
That's what they're trying to do, is get those same costs on the same drug here in the United States.
Yeah.
So it's weird.
I've heard of that being in the case, but like Canada and Mexico, you get the same exact thing for like way less. And I've never understood quite how that works, because you might not be paying it, but in the receipt there's a gigantic bill in there that somebody's paying.
Yeah. And I don't know much about it, but Mark Cuban is doing a pharmacy thing as well. But I don't know all the logistics of that one, but he has some type of pharmacy that you're supposed to be able to get your drugs cheaper with him as well. So
healthcare is changing. That's kind of the point. So all right. Annual enrollment period. Go ahead, Jordan. Now, we got through the drugs there. If you're not confused now,
you should just get an organic chemistry degree.
You explained it fine, but this is why people need somebody like you. There is an example of that.
Right. Yes. So
now let's go into another one, especially for I would imagine for people that have been in the plan for not very long. Why is open enrollment so important for Medicare beneficiaries?
Well, it's important because, like you said, they're going to have changes. So if they're on Medicare Advantage, their copays are going to change. Their formulary of their drugs are going to change. They're going to see now, if their drug is a tier 3, they're going to have a percentage and not a set copay. They're going to see all the changes. They get we call it ANOC. It's an annual notice of change. Everybody that's on Medicare gets this, and it should come out the end of September, 1st of October. And this is going to tell you the changes, and they'll put it side by side. So they'll put year 2026 and then year 2025, and they're going to show you what your changes are and what's going to be. So, and at that point, that's when you need to say, okay, this is going to work for me, or this isn't going to work. But they're not going to know their changes for what their cost is going to be for their prescription. So I've already kind of reached out to my clients and said, hey, send me an updated list of your prescriptions. So because I can't talk plans to anyone until after October 1st. But of course, I'll be out of the country, so I'm not going to talk to anybody till October 10th, but that's okay. We still have plenty of time. We have 45 days to do everything, but to make sure that everybody knows, so there's no surprises, right? No surprises, and they know what it's going to be. So, and I don't know what Part B is going to be yet either. I won't know till November. And that's probably going to go up again. Right now it's 185. So I don't know what it'll be. Call me November. I'll let you know.
Yep. And so the guy on Medicare over here is shaking his head because I've been on this long enough to know this game. So that payment comes out of Social Security, just so y'all know. And you have a total amount when you get your Social Security amount. They show the deduction for Plan B, which is 185. I'm hoping that it wouldn't go up, but and then you're also going to be able to go to your annual NOC changes through your plan and look up to see what your premium is. Mine would start on October or somewhere in there on a Plan G. I believe they let you know in advance, so I'll know what my price upgrade is going to to be.
Yes.
But rates go up every freaking year.
They do.
They don't go up dramatically, but they go up, right?
Yes.
So
you're right. They do.
Unbelievable.
Yeah, for sure.
Yeah. So another reason to call Crystal is because she can walk you through all this.
Yeah, this
So
is
they have a way
already.
to look. They have a way in their system to look up the drug pricing
Yes, we do.
once it gets posted. Jordan, they can go in and write in what their prescriptions are taking now. See who accepts it. See which insurance company is allowing it to be used, so they can, and what pharmacies are actually on their plan.
Okay.
Right. Yes. I look up all mine through the carrier's portal. So
I
I go
do too.
straight to the portal and look it up and just tell them, hey, this is what's going to cost. And then I also do it monthly because I feel like, but maybe I might be doing it wrong. I don't know. But I do it monthly because it shows a monthly cost.
Yep.
And I understand some people get it 3 months, but if you see a big charge, you're going to get scared at the 3 month cost. So that's why I break it down month by month. So
And I think a lot of people, when they look at that, are nervous to get the 1 month price because they think they're locked into, they have to get the 90-day price, right? They do
right,
not. You can set that
right,
up with your doctor however you want. Doesn't change
right,
the price, just changes how you get billed
right.
for it or how often you want to refill it. So that's cool. So
Yeah.
Jordan, I know we're just going right down the old 71-year-old guy's going right down the Medicare road here.
Who loves this episode?
I think you're the subject matter expert here, at least from the receiving end of it.
Right, right.
She explained that well. It's perfect.
Yeah, great.
And one thing I wanted to ask you about too is the common mistakes people make during this period, especially because I would imagine some people might treat it as set it as and forget it.
Right. Exactly. That is a problem that can happen. They just keep on going. And then when it comes January, they are calling like, oh my gosh, why is my copay $300 when it was only $250 last year, and so they don't look at their annual notice of change. And then also they could be something else that common mistakes, they answer their phone. So if you get a phone call and they answer their phone and it's these call centers and 1-800 numbers, then if they say yes 2 times to talking to someone, then they're going to change their plan, and people don't even know that they changed their plan. So that is so detrimental. It's really not good for the beneficiaries. And so I always tell my clients, I tell them, I said, you are my agent for life. I mean, I'm your agent for life. And then also, if you have any questions, concerns, anything at all, call me. Don't call the carrier first. If you need to call the carrier, I will let you know. Because there's some things I can't do, like change of address. I can't do that. You have to call the carrier for that. So there's some things I can't do, but call me first and I will let you know, hey, I can help you with this, but if not, call the carrier. So yeah.
And again, I'm going to go into this here. Ignore those TV ads if you would.
Yes,
because they're all set up to kind of steal you away from what you're doing, and they make it look like when they put the Medicare government picture of the card up there that somehow they're associated with the government, when in fact it's just another insurance agent you're going to be working with that's going to try to switch you. So
correct. And a lot of those ads too, Herdy, they're for people that have Medicaid and Medicare.
Right.
So to have Medicaid, you have to be low income for it to get Medicaid. And you have to have so much, you can only make so much per month or per year. And a lot of that, because they'll say, well, I saw the commercial and you get free food.
I get $900 worth of groceries every month.
Yeah. No, that's not for every day.
You may qualify. Call this number.
Exactly. And then they're going to switch you. So you've got to be
Don't do that.
So careful. Yes.
Call your agent.
Yes, for sure. Call your agent.
Yeah. And I'm imagining they're doing this to try to take you on, switch you over to them. But in the process, they, as you mentioned before the show, some of these changes can actually cause your rates to go up because you're going through underwriting again.
Right. So when you go through underwriting, that is when you're on a supplemental plan. And that when you turn 65, your initial enrollment period, you get it automatically. So there's no underwriting at the age of 65. But if you wait and you're still working, which you're more than happy to do, then you could have underwriting that you have to do. A couple of years ago, a poor gentleman, he got his Medicare from his workforce, because if you work for the government, they have government Medicare that you can get, even for the like federal postal workers, all that, they can get that from the federal government, their insurance. And he worked for in Louisiana, and something happened. He's 81 years old, and I don't know what happened, but he lost where the payment was coming out, EFT all the time. So he didn't make his payment. Well, he lost his Medicare supplement at 81 years old. So I went and this was like in January, I believe, of 2023. So it was a couple of years ago. And I went to him and said, okay. And he did not want an Advantage plan, because there are people that don't want Advantage plans at all. That's what I mean. Whatever is best for your needs as well. So what you want. So he's like, I want a supplement plan. So I'm like, okay, I will try to get you on a supplement plan. He had a stroke before. He had some issues. And I said, but we have to go through underwriting questions. And there was probably 50 underwriting questions that we had to go through. Oof. But he ended up getting it. The carrier called me and said, okay, we're thinking about, but he's got a couple of drugs that we're kind of concerned about. We're going to table him. And when they say table it, they're going to make him pay more, pay more of a premium for him. So I was like, okay. I said, so what is his premium going to be? Because he's going to get tabled. And they said his premium is going to be over $500 a month. So I said, okay, let me call him and see what he says. I called him and he said, that's fine. I'll pay $500 a month because I do not want Advantage. But he got approved. So you can get approved, but you have to go through underwriting. So it doesn't always happen. Last year, Harley and I, both of us, we worked with people with supplemental plans, and they didn't understand that the prescriptions they were taking was making it where they couldn't change. So they had to stay on that supplemental plan if they didn't want to switch to an Advantage plan, because they kept getting denied. I did 3 carriers for one lady, and she kept getting denied. And I'm like, okay, I finally called one of the carriers and said, okay, what is the problem? Because I didn't know her prescription drugs at the time, because it doesn't ask that for a supplemental plan. But I learned my lesson to ask the prescriptions now before we do their underwriting to make sure. But they were like, yeah, her prescription that she had like a back pain, and they were like, sorry, she's taking this narcotic drug and she can't get approved for a new supplement plan. So she was trying to save money, and you can't do it. So anyway.
So back to Hurdy's story. So so I think the rule is, right, Crystal, right before you turn 65, you've got a 3-month window to go ahead and get signed up, get your Social Security in order, get your Medicare started, which gives you leeway into that 65th birthday, right? Or if you miss that 3 months, and you actually have 3 months after that date that you can jump in that window. But if you don't jump in that window,
right,
you're going to it's going to cause some issues. And the other thing I wanted to say about the supplemental side is, if you are like me, and you're on Medicare and you're on your supplemental plan, mine happens to be Plan G. She knows what I'm talking about when I say that. Go ahead and get set up on their portals, get the notification set up, get all your bank accounts in so it's automatic draft, so you don't have to worry about it, right? And that way you won't have a problem, because the last thing a person wants that's getting older is to lapse a policy, especially on the supplemental side, because your underwriting your premium's going to jump way up if you have to re-underwrite, right? Because things happen. So
that's if you can get approved. Sometimes you can't even.
Right. And then you're really stuck having to pay out of pocket or whatever you have to do to fill in that gap. Right.
Right.
And I will also tell, and I know you're going to talk about it later, but also because some of these things there's a lot of things that you might need some additional insurance for, like a cancer policy or an accidental policy. It's not covered in this. is worth talking to Crystal about too, which we're going to get into at the end of this. But yeah, I just thought I'd bring that up. This is perfect because Crystal is the agent and I'm the person that works with the agent, right? And these are the things that, that becomes something you have to just really look at really hard, right?
Right.
Just
Right.
make sure
Yeah.
your prescription plan set up correctly. Do your research. If you have questions, call your agent. Make sure that you're on the right plan.
Correct. That is correct. Yes.
Now, you haven't mentioned anything about Advantage lately, and I want to make sure, since we brought that word up, that people know what we're talking about. Am I correct in assuming there's a couple of Advantage plans going away this year?
Yes, you are. Yes, you are. So there are some going away. So that's what your ANOC, your
Right.
annual
When you come
enrollment
back, for those
change.
people that are on the ones that are going away, that
Yes,
was where I was
yes.
going.
So that will tell you there are, and then also there are some carriers are not paying commissions anymore to us agents as well.
Wow.
And if that happens, I will still tell you, okay, this plan is good for you, but I cannot sign them up for that plan. So they'll have to do that on their own. I will help them, but I cannot be their agent of record.
Right.
Because if something happens and I get a complaint or something like that, I can get in really big trouble. So
Right.
so I can't sign people up if I don't get a commission from that as well. But
Right.
yeah,
Okay.
so that is true. Yeah.
Okay.
Yeah, they're making lots of changes for sure. They are making lots of changes.
So really quick, because we ran through a few things just a second ago, I just want to make sure that people know the questions they should be asking themselves or potentially you to know if their plan is the right fit.
To know what?
If their plan is still the right fit for them. Because,
Yes,
things
correct.
are
Yes,
changing. Like they
Yes.
just move the rug underneath you. Like, are you still in good standing?
Right, exactly. And you say this, but yesterday I reached out to a bunch of my clients and I wrote to them. I told them about the $2,100. I told them that their deductible could go up. We just don't know yet till they get their annual notice of change. But if they're happy with everything and they look at it, then they don't have to make a change. You don't have to stress yourself out because this is very stressful for people on Medicare. There you go. Because you're dealing with their insurance and it's very important that they need their health insurance at this age because anything can go wrong anytime. So that it makes it very nervous for them. And also you got to make sure that the hospitals are in network, your doctor's offices are in network, the specialist, all that kind of stuff. You got to make sure it's still all in network because if it's not, then you can't do that. Like there was a few upsets this was December 1st and Aetna pulled out of Texas Health, I believe. So all the doctors that had Aetna patients, they couldn't see them anymore and they had to find somewhere else to go.
Right.
Or thank goodness it happened right before AEP ended, or they could switch their plan to a different plan. So even if you think that your plan's still good, you better make sure that you're still in network with everything.
Yeah.
On Advantage plans for sure. So
yeah, definitely.
Yeah.
Okay, so then let's dive a little bit deeper in there to guide people like what they should pay close attention to when comparing the plans. There's the premiums, the networks, prescriptions. You just mentioned like if your doctor's is a network or not, because that can switch from year to year.
Yeah. I would say just make sure that the plan is best fit for you. Not for your neighbor, not for your sister, not for someone that you know, your friend, that fits you and your needs because everybody's needs are different. No one is exactly the same. Even your spouse, you might live with someone that your spouse and y'all don't have the same plan. You don't have to have the same exact plan. You can be different, but you got to make sure it's for you and your needs. That's what I would say is really important.
Yep, yeah. I agree.
That totally makes sense. And is there any hidden cost or gotchas in there that people could miss?
Yes, I know we've talked about this a lot, but it's going to be the prescription drugs for sure.
Yeah.
Prescription drugs for sure.
Yeah,
and it's going to be the copays for the Advantage plans as well. So they gotta, and if you don't know your premium for your supplement plan, that's going to be a gotcha. So that premium, but yeah, so you've really got to look at that annual notice of change for sure.
And you know what's really cool, Jordan, is because I've been set up right and everything. It's really cool when I go to my doctor. I hand them they already have my Medicare, my Aetna G plan. They have my prescription, and you know what? I go in, I walk out, everything, and then I get my notices 30 days, 40 days later, what was paid for by Plan B and what was paid for by the supplemental, and generally there's not a whole lot left over for you to pay. So yeah, so it's really cool if you do it right, because then you don't have to stress out about going in and writing checks and how expensive it'll be. Just hand them a card and go.
Right, exactly. Well, and that's really good. That's a good thing about supplement plans, because you have to pay your deductible, which is this year is $257. I don't know what it's going to be for 2026 yet.
Who knows, it's going to go up.
But yeah, as long as you pay your premium every month and you pay your deductible, you don't pay anything else when you go to the doctor if you're on Plan B.
That's
so
right.
yeah. So, and that's why a lot of people like supplemental plans, because they like to go where they want to go, who they want to go to. They don't want to have to say, you know, I want to go here, I want to go there. I will say the difference, what I say for a Medicare supplement plan, that is pay as you know. So you know you got to pay that premium every month. And then Advantage plan is pay as you go. So in Advantage plans, you're going to pay a copay every time you go to do something at the doctor.
Right.
So,
Okay.
So
and
that's
we've mentioned
the thing to remember.
We've mentioned Advantage plans now a few times. Can you break those down for us, for those that don't know?
An Advantage plan. Advantage plan. I'm sure most people heard of Plan C, because you have A and B, which is Medicare. A is hospitalization. B is the doctor's office and different things, labs, just different X-rays,
MRIs,
ERs, all that kind of stuff is Part B. And then C, they say that's the Advantage plan. And then you have Part D, which is your prescription drug. But the C is, it has A, B, and D all combined in one. So on an Advantage plan, most Advantage plans do not have a premium. So you're not going to pay a premium, but you're going to have a copay. And they have max out of pocket pay for the year. So that max out of pocket might be $4,000. It might be $4,100. It depends on what plan you pick. But once you reach that max out of pocket, you pay nothing else after the rest of the year. But they're going to have a copay if they go to the doctor, if they go to a specialist. Mostly not if they go to the doctor, they don't have to really pay anything for that. But if they have to go to a specialist, inpatient hospital. So inpatient hospital, you're going to have a copay for how many days you're there. It depends on the plan that you pick. You're going to have an outpatient copay. They have preventative plans that those are normally, you don't have to pay for the preventative plans, which is really great. If you get an MRI, a CT scan, the ER, urgent care. But with Plan C, you have dental, vision, and hearing as well for most of the plans. But like Birdie, he doesn't have dental, vision, hearing unless he buys it outside, right?
Yeah. So, but the advantage to me is I know on my Plan G what my pricing is going to be. That as long as I'm paying my premium, which isn't that big, by the way, because I'm pretty healthy, but normal rates go up, right? And so for instance, I had my 70-year-old, and I'm not going to get into what it was for, but it was to check something to make sure everything was okay, because you're at males at a certain age, right? Everything was fine. So they ran my MRI because I'm on the supplemental G plan. That MRI went from $2,500 to $200 out of pocket. So why would you? So for me, it makes sense to be in the Plan G, because that MRI, if I'd been on Advantage plan, would have been whatever that copay is for that. Right. And so you're playing kind of, it's just kind of what it's like you said, Crystal.
Exactly.
Whatever your personal needs are, you know, if you just want a copay plan, you don't want to worry about premium. Advantage plan if you need like dental
Right.
work, if you need hearing aids, you know, you
Right.
want to do that for sure.
Exactly.
Hope
And
that I hope that made sense. But
no,
I'm just
you're
saying,
great.
you know,
You're great. And I will say that MRI that you're talking about on Advantage Plan, if you have an MRI of your elbow and then you have to have an MRI of your shoulder, that's two different copays.
right.
So, so you know, you just got to make sure whatever plan you're on, you understand,
Mhm.
and that your agent tells you exactly what you're. Because when people leave here, like I had a lady last week sign up, new to Medicare, and she's like, "Oh my gosh," she goes, "I've been looking for you for months. Where have you been?" And I'm like, and she got a referral from a doctor's office. So
Right. Good.
a doctor's office is a great referral for me. Great. So if y'all know any that need help, let me know. But she's like, they saved me. They gave me your name and information, and you were wonderful. You were great. And she goes, I'm going to tell all my people, everybody I know, to come see you. So
Yeah.
yeah, you
They
just
should.
got to listen to everybody for
Yeah,
sure.
yeah. Y'all are good.
And that brings up a great point, which is helping people navigate that.
Yeah.
So, how can caregivers or even family members support their loved ones during this open enrollment period?
Right. If they allow you to talk to them, like because they think that you don't understand what's going on. But
Mhm.
if the family members can, if they want, go with them to meet the agent and kind of say, I'm just here to listen. I want to understand in case she has any questions or concerns or anything like that. And just make sure that you understand what it is that she has. If she has a supplement plan, you get that. If she has the prescriptions, you know what that's going to be or what that's going to cost for them, because sometimes they forget. They forget what you tell them, and so they might call you again, hey, I forgot this. So that is what's really in support, to support them and to make sure that you understand as well as them, and I can break it down elementary for you. So, and that's what you need. You need someone like you said, just to break it down where you don't talk over their head, but elementary style. So for
Yeah.
sure.
Yeah.
Yeah, I ask people to tell it to me like I'm 5 all the time.
Yeah. Yeah.
Me too. Me too.
I'm in fourth grade. Explain that again.
Yep.
Exactly. I think
Yeah.
we're all that way, aren't
Okay,
we?
so one thing a question I came up with from the last time is that are there some people that are on Plan B and then some of them have an actual hospital plan directly through a hospital, like Scott White used to be part of Baylor now? Do they have their own plans?
Do they have like a hospital indemnity plan?
Yeah, I mean, do they have plans or I guess mom's on a supplemental. She's 92. It seems like every time she walks in there, there's no check. There's nothing. She's, she doesn't pay a dime.
Right.
Does that
Well,
does that make sense?
because well, if you're in the military, so if you're in the military, you can have, there's a thing called TRICARE. Have you ever heard of that before?
No.
So that is an insurance. If you were in the military and you did your 20 years and retired military, you get TRICARE for life. So you get it under 65 and over 65. So you get that forever. And a funny story, a lady I just went and talked to in February, actually, she's like, I never pay anything to the hospital, like you're saying, Herdy. And I'm like,
Yeah.
wait, she was on a different plan that was going away. And I was like, you're on this plan, you should have a copay. She goes, no, but let me show you this other little card I have. Well, she gave it to me and she had TRICARE for life. I'm like, well, you're
Well,
never going to pay anything. You have TRICARE for life.
right.
But
Yeah.
she also did an Advantage plan because she wanted
Yeah.
to have extra coverage. And like
Right.
her prescriptions were astronomical. They were so expensive. And if you're on TRICARE, then they have a prescription plan that you can go to and sign up for that. And I helped her. It was kind of difficult at first, but once she got on it, one of her prescriptions was like $100, and she's like, oh, I can do this. So you just have to show everyone, like when you meet them, like, show me everything that you have. So
Okay.
make
Pull
sure.
out your cards.
Yes, pull all the cards out. Pull them all out.
Yeah, I think what I was trying to say was she is within their hospital network, right? She does the Plan B, but then she pays a premium to Scott and White Baylor, right? But everything's done through them. She can't go outside that network at all.
Gotcha. Okay.
Okay.
Gotcha.
So I just wanted you to know there are networks like that still out there. So,
Gotcha.
unbelievable. Okay.
You know, like we're 44 minutes into this conversation and I'm
Oh
overwhelmed.
gosh, it went by so fast.
So let me ask you, what resources are available for people who feel overwhelmed by all these options?
Well, let's see. Their resources. Their agent is their resource. That's their
right.
number one person. And then also, I would say their resource is their doctor's office. So that was a good resource for them as well. I would say those are their top two great resources, is those two. And then most people, after they've been on Medicare for a while, they come to understand it and they can get it, you know. But yeah, for sure, I would say those are your top two best resources, is your agent and your physician.
Yeah, I agree.
Yeah. And what if you're not, like, what if you don't know your agent? Because you're assigned one automatically, right?
No. Well, let me rephrase that. People that come to me, they know that I'm their agent, because I tell them, I'm your agent. Here's my card. Here's a magnet. Here's all this stuff. Put it on your refrigerator. And that way, if they get called from an 800 number, then they're not going to know their agent, because it's just going to be somebody. But they can call the back of their insurance card. There is a customer service number there, and that carrier will help them as well. But they may not know who their agent is, but they can ask their questions. But you also have to advocate for yourself. That's another resource you're going to need to know, is you've got to advocate for yourself as well. And make sure you know what you want, and don't let someone talk you into something that you see on TV and a commercial that you know exactly what you and your needs are going to be, for sure.
All right. And so guess what, Jordan?
What?
It is rewind time. Ooh. So we've had a new segment. We're gonna give your brain a chance to kind of go from swelling down back to normal for all of you listening in. And no, it's fantastic. We love it. It's great. Crystal makes this really sound easy. Take my word for it. But we're going to rewind, because what we're doing now, Mansfield Buzz, is we want to go back and show you a short from a previous show. So you guys go back and look at some of our guests we've had, because we've done 74, 75 shows now with local businesses. So go back and check some of those out. So Jordan, take it away. You've got the music and the video over there. Let's go ahead and hit the Mansfield rewind.
Quick rewind, keep it tight. Highlights, prime to ignite. Catch the vibe, feel the rush. Previously on the Mansfield Buzz.
Then I play several other instruments. I play pedal steel and I play bass, dobro, a little bit of mandolin, about that big. No. So enough mandolin to get me in trouble and to allow me to teach beginners. So, but guitar, I've been playing guitar for 52 years now. No, 54 years now. 54 years I've been playing. I'm 64. Started when I was 10. My father was a professional musician, grew up in Michigan. My dad played Western swing, country, had a great band. And then my grandfather, from my mother's side, owned one of the largest clubs, music clubs, dance halls in Michigan. We were about 15 miles south of Detroit. So I grew up with my dad loving Western swing and country and jazz, my mom loving Motown, because I grew up in Detroit. Okay. I remember when I was 10 years old, we used to go down and see the Motown Review at the State Fair, where they would play it. They would have the Funk Brothers, and they would be backing up. We would go see, for 25 cents, we would go see Diana Ross and the Supremes, Marvin Gaye, the Four Tops, Little Stevie Wonder and his Magic Harmonica. And I remember being about 9 or 10 years old, going and I was around music my whole life with my dad. But when I would see Little Stevie Wonder, he was probably 16, 17 years old then, playing drums, singing, just playing harmonica. I knew that's what I want to do. This is what I want to do, you know? So I was always, I had a great a wealth of information growing up with Motown, rock and roll, country, Western swing. Music was in our house 24/7. That's all, you know, that's what my family celebrated was music. And so I started playing when I was 10.
Perfect. So I think I made that short 3 minutes. So that's okay. I didn't look at the time on it, but that's still great. So support Rockstar Tomorrow Mansfield. Yeah, I just drew a blank there. Go check out Arnie. Get your kids in there to get them music lessons, because I'll tell you what, they are awesome, and they have great teachers, and they have a great organization over there. Please go support them. Get your kids signed up at his school. You want to take them after school somewhere and have some more time together, get them in music lessons over at Rockstar Tomorrow Mansfield. All right, we're back to insurance. Thanks, Crystal, for being patient on that segment. We appreciate that.
You're welcome.
That was our first time to run that. So really our second time. So we're testing it out, okay?
No, that's good. That's good.
So it brings us back. Now, how can I tie insurance to music? Well, I mean, they're both
music to my ears if you have the right agent.
There you go. There you go. I could say at Schuder Insurance, we make Medicare less messy. How's that?
Oh, I like that. That is, it is messy.
Yeah.
Have your client strike the right chord.
Right.
Oh, come on. We can go all day.
So we were talking about resources to be a little less overwhelmed with all this information. If somebody is unfortunately enough to not have you as their agent, can they call you?
Yes, they may. They can call me, and I will go over what they have with them and let them know, hey, this is great for you, or maybe this might look better for you, to see what. And if you also our health is sometimes always changing. So if they get a chronic, problem during the year, if they become diabetic, or they have AFib, or they have heart attack or stroke or something like that, there's also plans that you can change in the middle of the year too. Those are called the special enrollment periods. So we can change. So you don't always have to make your change during annual enrollment period. There's also special enrollment periods that we can make a change for you as well. Cool. So, but you got to talk to your agent for that,
In I was thinking also maybe a bit of a tactical question, because with insurance and pre-existing conditions and all that, a lot of people are now getting hearing aids, and you did mention the Plan C helps with that. If you're not enrolled in one, should you maybe wait to do a hearing test, enroll first, and then look into that?
No. Well, I mean, you don't have to, but you can. And with an Advantage plan, and even if it's a standalone dental, vision, and hearing, it's not going to pay for the whole amount. You're going to have to pay some cost out of pocket for that as well. So you can wait, or, you don't have to. When you join Medicare, it doesn't matter what your underlying conditions were. That doesn't matter. That's not part of your, unless you're already on Medicare and you have to change to a different supplement plan, then your underwriting comes into place. But so if you go to the doctor at 64 and they say, oh, you might need some hearing aids, and they might come back and say, well, I might wait a year because I'm going to get on Medicare, and Medicare will help pay for some of that cost for the hearing aid. So you don't have to pay everything out of pocket for it. Smart.
Okay. Yeah, I was wondering because a lot of just people that I know have been getting hearing aids, and
right.
I've noticed I've had to repeat myself to Herdy a little bit more lately, so I figured I'd ask.
What?
So funny.
What?
Yeah.
No, I'm kidding. Hey, so a question on that. So let's say they wanted to buy their own individual vision and hearing plan. Generally, those aren't that cost prohibitive, right? They're reasonably priced, correct?
They are reasonable price. If you want a dental, vision, and hearing plan, and you can pretty much get those any time of the year.
Right,
So if you
right.
decide you don't want it right away, you can wait, and those are, it's probably, it depends on what plan it is, but it could be as low as $25, $30 a month
Right,
to
right.
maybe $75 a month. It
Yeah.
just kind of depends on which plan that you pick.
Which is
So, and
cheap.
we have several that we can show you as well.
Good.
So.
Yay.
Now they may have some waiting periods. So like you might have to wait a year to get dentures or to get a crown or something like that. But, if you can wait, go ahead and get the plan now and then do it in a year, if you
Right,
can.
exactly. Yeah. Yeah, there's
So,
always a few restrictions you need to know about.
yes, I know, unfortunately.
Yep.
And I was going to ask you too, you have some dental vision and hearing options for people under 56.
No, that should be 65. Hang on.
Under
That was a typo.
Yeah.
So Hurdy's gonna edit his dyslexica here.
Oh, it's okay. That's
Dyslexia.
okay. We do have them for under 56 too.
I know, but
Let me guess, it's the same one.
It's okay. Yes, we do. If you've heard of the Affordable Care Act Marketplace, that is that's for people under 65, and that is the federal insurance that they did a long time ago. Obamacare is pretty much, that's what it is. But they have open enrollment November 1st through December 15th. So you can change anytime during that time, or there's also special enrollment periods throughout the year. Like if you lose your job and you lose your insurance, if you get married, if you move out of one county to a different county, there's just different things that can happen that you can also get that. And like I said, that has no underwriting. So if you have a problem, like I signed up my person that was on an individual health insurance plan, and it wasn't all that wonderful, and he needed a couple of knee replacements. So they were like, what can we do? And I said, okay, we can get you on the Marketplace plan and he can get his knees replaced. So that's what you do. So, and he's getting his knees replaced. I think one is in October and one they're going to do next year. But of course you do have to meet your max out of pocket and your deductible, but your deductible on those plans could be $500. It could be $7,500, $9,000, but the max out of pocket could be anywhere where you don't pay anything else. Once you pay that amount, it could be $7,000 to $9,500. It just depends on the plan that you pick, but you need to be careful with that plans. A lot of people try to do that by themselves on the Marketplace, and unfortunately they don't understand everything. And here we go with prescription drugs again. They pick a plan that they have to meet the max out of pocket for prescription drugs, and sometimes that's $4,000. So they have to pay the whole amount of their drugs until they reach that max out of pocket of $4,000. So if you work with someone like me, I don't pick those plans because I know that's not a good plan for you.
No.
So I pick a plan that their drugs are going to be $20 or
Right.
for generic, or if it's going to be $40 for
Right.
the preferred drug, so you should all, no matter what your health insurance you have, whether it's, a child or people under 65, people over 65, you need to work with an agent who will help you with your needs for sure. And then we have hospital indemnity. So we're talking about Advantage plans again. They have the copays, and some of those copays could be $300 for days 1 through 6. So that's $1,800 if they're in the hospital for 6 days. Well, you can get a hospital indemnity plan, and you can get those anytime throughout the year. Doesn't matter when you sign up, and you would cover that $1,800. I do it as you cover for 2 years. So if you cover, so you would make it $3,600. And that could probably cost you $50, $60 a month. It's not very expensive at all. So there's just different things. You can have short-term care. There's all kinds of extra supplements that you can get to add on to either Medicare people or to under 65 people. It doesn't matter.
And
So,
Crystal,
and I am your person to come to. So,
And Crystal, I would say one of the biggest accidents people do is they don't get a long-term policy.
yeah, they're very, very expensive.
I know they're expensive, but
Yeah.
but
You need to get, if you're going to get a
long-term care.
you need to get at the age of 50 or younger.
and you need to talk to Crystal because
Yeah.
they are super expensive and hard to get or hard to
Yeah. A
Hard to
long-term care, Jordan, is if someone is in the hospital for a long period of time, if they have to go to a nursing home and stay there, that's a long-term care facility. So,
Yeah.
anyways.
And they're short-term care too.
Yes,
Jordan,
they are. They are.
Wow. I feel educated.
Good. I'm the Medicare educator. That's what
Right. Even more so, even though I know what's going on with my plan, it never hurts to hear, what's out there. So one thing you did mention was if you're under 65 and you're getting regular insurance from you, there is no requirement that you go, anybody can sell that policy, correct? But
For the marketplace?
Right. For yes.
For the
So,
marketplace, yeah.
Right. For the marketplace under 65.
Right. I do have
Crystal
other
knows
plans.
what she's doing.
Yeah. I have other plans, but those are going to have underwriting. But
Yeah, they're going to be normal insurance
no
policies.
underwriting.
Right.
The marketplace is some people don't like it, and a lot of doctors may not take it, but we'll find you a doctor that does. So that's why you need to work with an agent to make sure.
Pre-existing versus underwriting
Correct.
without pre-existing.
Yeah. Right.
That's
Exactly.
really the bottom line.
Yeah. So
Whew.
for sure.
Okay, everybody, if you hadn't be listening in today,
Wrap your hair around.
and you now need to go get a drink, knock yourself out. If you're getting ready to turn 65, you know darn well you need to start planning right now.
Right.
You need to really jump on it. And if you're 64 and you're a real organized person, you might start researching what you need to do when you get ready to turn 65.
Yes. Yes, exactly.
Ask me if I did that. I did. Thank you.
Yes, for sure.
But Crystal, you had mentioned something, and I want to make sure we nail this down. Your typical client, you like doctor referrals because you have certain doctors that refer you quite a bit, correct?
Yeah, I would love doctor's offices. Also, another referral for me is a probate attorney.
Right.
So that's good. And of course, financial advisors.
Right. And understand that she can't pick up the phone and smile and dial. Okay. You're not allowed. You have to have somebody approach you, correct?
Correct.
I just want to make sure what the rules are. What are the rules?
Right.
Yeah.
I cannot approach a Medicare person turning 65. So they have to come to me and ask for my help. So
So you work up. So that's a really big referral source for you is to have those folks that are
that would be
to you.
Great. Yes, for sure.
All right.
Are you allowed to advertise at all?
Am I allowed to what?
Advertise at all?
Yes, I can.
Okay. You just can reach out
by mail. By mail. So I can send stuff in the mail, but Herdy, how much mail do you get about Medicare? They throw it all away. So it's really, it's not gonna be a good ROI.
We're posting. So just to answer that, Jordan, a little bit, we're posting tips on our Google business page, right?
Oh, okay. Yes.
So we use tips and advice and kind of like Q&A answers like we're doing on this show so that it generates the educational side, but she doesn't say buy this policy today for $250. She can't do that, but she can give tips and she can give educational information.
Yes.
So that's what we're doing.
I give everyone a Medicare. I have a Medicare one-on-one is what I call it. So it's educational, and it is strictly original Medicare. So I tell them what original Medicare is and how it works, and then you do it that way. And then you decide, okay, do you want to stay with original Medicare or do you want to cover your gaps? And when you cover your gaps, you're covering it with your supplemental plan. You're covering it with an Advantage plan. You've got to have your prescription drug plan, because if you don't, then you could get a penalty for the rest of your life. So there's penalties out there as well. So you really, really need to talk to someone probably 63 and a half, 64 to make sure you understand everything that's happening with Medicare.
Yeah. So like this podcast is very educational, right? She's not getting in specifics. She's just saying, here's things you need to pay attention to,
Right.
use your agent, things of that nature. So it's all good.
Exactly.
Well, thank you. So
Me. Sorry, we ran over.
Give me your, no, you
Good.
didn't run over. What's your website?
It is SchuderInsurance.com.
Okay.
You'll see my beautiful daughter on there. She has a video. So she's talking about Medicare.
I know she's there.
So
Let me see if I can put that up. I want to make sure I get that up there.
And we'll definitely put it in the show notes as well.
Yeah, and what we do is we go ahead and put a link. I'll put a link in the YouTube link for you.
Okay.
And it will automatically link back to your website from YouTube. So tonight I'll send you out a link, but if you'll hold tight with us after we end the stream, we want to make sure your audio uploads to our stream server. So everybody, thanks for being part of the Mansfield Buzz. We are on next Thursday. I believe next Thursday is, well, I'm not really sure who it is. I think it's Stacy from the Mission. Is going to we're going to talk to her a little bit, and she's got some events coming up that are really cool. And actually, the day she's on, there's going to be an event that she handles, so it's going to be really cool. So y'all need to pay attention to Mansfield Buzz next week. Make sure you subscribe to the channel. Y'all have a great day.
Thank you. Bye.
Thank you.
Bye.
Bye, y'all.